evening, ladies and gentlemen. Magandang gabi po sa inyong lahat dito sa Amerika. Good morning, Philippines. How's my audio? Okay lang? Can you hear me, Ate Zen? All right. And of course, may may backup yan. Yan ang aming station manager from PHLV Radio Las Vegas. Thank you so much. Alam mo kung pwede ko lang siyang bigyan ng award, ha? Pinakamabait. Philanthropist yan. And of course, ang ganda ng boses, ha? Thank you so much, Johan, for being with us every Friday behind the scene. Kahit wala kami, nandyan ka pa rin. Thank you again to all our followers, donors, supporters of the Filipino-American Cancer Care. My name is Josie Moralidad Azayman. And next week, it's going to be August. And then we're going to have our free cancer screening, but I'm going to talk about that with our board of director. So, ngayong gabi, Emma Rich is having a vacation in Florida, but I would like to welcome our board of director, Mrs. Zinaida Steinhauer. Hi, Nang Zen.
Hello, Josie. Hi, everyone. Hello to all our listeners in the Philippines. Magandang umaga sa inyong lahat dyan. And also to my kababayan in Iloilo, maayong aga sa inyo tanan. So thank you for inviting me tonight, Josie, to be one of the interviewers and to be on this show again. I missed it. I haven't been here in a while, but I've been very busy also. So welcome to our regular FACC program on PHLV.
Nang Zen, are you using an electric fan?
I have
beside
the
you?
air conditioner on, so you want
Oh
me
my
to turn
gosh.
it off?
No, you're fine. You're fine. Kasi I have an electric fan next to me, I'm having hot flashes, but I'm okay. Pinatay ko na lang kasi maingay talaga yung electric fan.
Yes, I know. It's very hot, even with the air conditioner on, So I know in the basement we don't have air conditioning, but there is an electric fan that goes around, it's a revolving fan. So it's actually cooler sa basement than it's up here because as you know, heat rises. So the more you're up in the building,
Yes.
like on the second floor, ang second floor namin talaga, it's like it's really hot. So we need the air conditioner there all the time, especially when you go to sleep. You need cool air to cool your body so you could sleep better, right?
Yes, and you know what? Yung aking aso, because he's a golden doodle, he needs an air purifier and electric fan. So every night, kompleto, may ceiling fan, may side
Wow.
fan, may air purifier. And ayaw niyang matulog sa bed niya. He wanted to sleep with us. But anyway, bago natin ipakilala yung ating special guest ngayong gabi, no? Dito po sa ating radio show, On the Air with FACC, we would like to take this opportunity na imbitahin yung ating mga viewers, followers, supporters, sino man. Ate Zen, we have that free cancer screening. Would you like to tell everyone, Ate Zen, why is it very important to have a cancer screening?
Well, a lot of times cancer screening is really important, especially for women who are over 40 years old. There is a lot of cases or studies that have shown that women over 40 and with either pre-existing conditions or have had mothers or relatives with cancer they have a very high risk of having cancer. So in order to prevent this, we have this cancer screening program, which is on August 12th. It's free. It's a free program for those who are living in the Virginia area. So if you're over 40, please, and if you haven't had any cancer screening in a year or more than a year, please give us a call. Please call Josie. There's a number that we will give you, and it's also on our Facebook. So you can go to our Facebook and just contact that number and see if you're interested or you want to come for this free cancer screening. It really is a benefit, or it's beneficial to those women who are over 40 and have never had any cancer screening, because, for you to prevent, I mean, we are in a preventive, program here. So we do want to prevent cancer. And if cancer is caught in its early stage, it can actually be treated, right?
Okay.
So,
Yeah, early prevention can save lives. And may isa pa tayong event, no? We're gonna talk about that maybe later after our interview. We have a Zoom bingo, a Zumba and bingo, and then we have an upcoming fashion show in October. You know why? Sabi nila, hindi ka ba napapagod? Of course, napapagod ako. Pero alam mo naman yan, Ate Zen. Ate Zen is the chairman of the Financial Assistance Committee. And you know, Ate Zen, na napaka-overwhelming ng numbers ng mga taong humihingi ng tulong po sa FACC. And think about it, we are giving $1,000 as financial assistance. So we have to work hard because we're still,
Right.
waiting for that grants, whatever it is. Kung sino mang makapagbigay sa amin ng donation, anybody can actually make a donation on our website, no? Just click the button. You can do a one-time donation or monthly donation or any other
Right.
recurring donations, no? And we will
Right.
issue a receipt. Yes, Nang Zen?
So, yes, that's true. So, I think it's time for us to introduce our guest speaker for tonight.
Yes.
Dr. Leo Ray Saligan.
Yeah,
And
before yes,
this
if you
doctor,
don't mind, before we introduce him, no, I'd like to give you a little bit of background sa ating mga viewers, no? He is actually a nurse, a scientist. Katulad mo rin, Ate Zen, no? He has been a nurse for 31 years, evolving into various roles from a staff nurse, nursing faculty, advanced practice nurse. Ang dami palang klase ng nurse, Ate Zen.
oh yes, there are many different fields of nursing. So, it's not just hospital nursing, but you can go into, there's all different kinds of hospital nurses. There's specialties in the different kinds of diseases like oncology, you have med surg, you have wound care nurses, you have nurses in the ICU, nurses, cardiac care units, there's all sorts of nurses, but there's also nurses who are involved in research. Right, like nurse Leo Ray Saligan, Dr.
Yes.
Saligan here. He has a PhD.
Yeah.
And FAAN,
Yes.
a certification.
Yes, and he is currently a nurse scientist, as we said, no, with the Division of Intramural Research of the National Institute of Nursing Research in the National Institutes of Health, Bethesda, Maryland, and Jansa NIH, no? He serves as the chief of the Symptoms Biology Unit. You know what? I'm very proud of you. Kayong mga nurses at yung mga teachers at lalong-lalo na yung mga Filipino na nandito sa Amerika. You know how it is, Ate Zen, di ba? Every one of us has a story to tell, and to be able to meet people like this, that, it's an American dream.
That is true. And of course for Leo, can we call you Leo?
Absolutely, yes.
And for Leo here, he's a very distinguished person here because, working for the National Institute of Health is a very prestigious, employer because they do a lot of research in many different areas. And so as a researcher, he's a nurse researcher and he was a nurse scholar before. So, and he's the chief of the Symptoms Biology Unit. So it's really a very prestigious position that he has with the NIH, or the National Institutes of Health.
Yes.
So,
and he is a fellow of the American Academy of Nursing. So, ladies and gentlemen, please welcome on our radio show on the air with FACC, Dr. Leo, Ray, and Saligan. Can we just call you Leo?
Oh, yes. Please call me Leo.
Okay. So before we talk about oncology and cancer research, tell us about yourself, your background in the Philippines, and how long have you been here in the United States?
Yes. So thank you so much for inviting. Good evening, everybody here in the US, and good morning in the Philippines. I am pretty comfortable talking in Visayan because I'm from Mindanao. So
Oh, okay.
the Tagalog is a little bulol. But ayong hapon o gabi sa US and maayong buntag sa Philippines. And I'm so excited to have this opportunity and really thank the Filipino American Cancer Care for inviting me to talk today about a lot of opportunities, especially partnering with the Filipino American Cancer Care on ways that we can raise our voices, our experiences, especially those who lived through cancer and survived through it. And that's basically what the reason I came on today, and why I became as a nurse scientist. To start with, the question of my journey. I came here directly from the Philippines. Graduated in a nursing school back in 1992, and I came over in 1994 in Texas. Actually,
Mm.
I started as a nurse through an employer. I started as a nurse aide in a nursing home, and then went to training as an ICU nurse in a county hospital, still in West Texas, in Odessa, Texas. So I had an opportunity then, because I was a new grad, of course, an opportunity to be trained by a lot of really amazing and brilliant nurses from the Philippine Heart Center.
Mhm.
So they trained me to do to be a nurse who took care of open heart surgery patients.
Mhm.
Right.
So you told me before that you finished nursing also in Silliman University?
Yeah, I actually finished my bachelor's in medical technology in Silliman University.
Mhm.
Ah,
Then I
okay.
went to and I
Wow.
went to have my nursing in Cagayan de Oro, in Liceo de Cagayan.
Yeah.
Then I
Was it always your dream to become a scientist? That's why you studied medical technology?
Yeah, I've always wanted to become a scientist. Science has always has fascinated me. And one question leads to another. That's always been a thing that really inspires me, of keeping that question going. And that's why I went into biomedical science and eventually became a scientist, which is such a dream come true. So after my training as a open heart surgery nurse in ICU, I moved to Virginia in Hampton Roads, in Norfolk, Virginia.
Mhm. Virginia
Mm,
Beach.
right.
Yeah, in Virginia Beach, and where I continued as an ICU nurse. But as I was, when you become a nurse, especially on the floor, you get looped into this routine of going to work and your shifts. But I sort of paused and stepped back and said, I need to advance my education further. I need to
Mm-hmm.
fulfill my dream. So I went and studied and got a master's in nursing degree, a master's in a nurse practitioner degree. So
Uh-huh. So you
as a
became a nurse practitioner.
yes, as a family nurse
Okay.
practitioner. So while I was training as a nurse practitioner, I was approached. My training was in Eastern Virginia Medical School,
Mhm.
Uh-huh.
and I went and that was my rotation. My program was with Hampton University, but I was approached because Old Dominion University, which is a state university in Norfolk, Virginia, was looking for a minority male nurse to be a member of their faculty for the
Okay.
nurse
Oh,
practitioner. So it was
I know
just
some
lucky.
friends who works in that Old Dominion University.
Yeah, so it was
Oh.
such a blessing, and I said I never had experience as an educator, so and they
right.
said we will train you, we will do that. So I joined them. I joined them as a faculty with the nurse practitioner program, but I also practiced because my background again was ICU. I was required. In order to teach, I was also required to do part-time practice as a nurse practitioner. I worked as a pulmonary nurse practitioner with
Oh,
the ICU doctors that I worked with in ICU. So I became their NP and took care of mostly respiratory, COPDers, asthma, sleep
mhm.
apnea. So I had clinics like that, and also sarcoidosis. So while I was
Mhm.
teaching at Old Dominion, the dean approached me and said, "Hey, we really wanted to keep you, but you need to take and pursue your PhD in nursing."
Oh.
And I said, "Oh, I loved working here. Okay, I'll enroll." I'll enroll.
So did they offer you like some kind of a scholarship to pursue your PhD?
Oh no, not no, not yet. But I really loved the group. I really loved the school. So I said,
Mhm.
that's also, it would also be good for me to pursue further education. So
Yeah.
I
Right.
continued, and at the very end, when you're taking at the almost graduating, you have to complete a dissertation activity.
Mhm.
Right. Right.
And he said, "Oh gosh, I'm working full time. I don't have money, and it gets expensive
Yes.
and time consuming." And so I said, where should I go? Oh, NIH, the National Institutes of Health in Bethesda, is all research. So
Right.
Wow.
That's true.
why
Mhm.
not join them, get the data, finish my dissertation, and then come
Uh-huh.
back and teach?
Right. Right.
Mhm.
Wow. What an
Yes.
opportunity. That was a
Mhm.
great opportunity
Yeah.
opportunity for you, Leo. So you applied there for your dissertation
Yeah, I applied there actually as a nurse practitioner
as a nurse practitioner. Okay.
in the
Mhm.
To finish your dissertation.
to finish my dissertation. I told him just 1 year, I'll finish my dissertation. So I
So
did. I completed and defended and graduated. And
Mhm.
then I was ready to go back from Bethesda. I was ready to drive down to Old Dominion to Virginia Beach. And I emailed the director of the nursing research and said, "Hey, I just obtained my PhD. I'm heading down, but if you need anything, I'm always I love to collaborate." I said, "Hey, come over." So I went there. I thought it was just an introduction. They were
Mhm.
actually interviewing because they were.
Leo,
oh my
marami bang mga scientist na Filipino sa NIA?
No, I'm the only one, unfortunately, in the intramural.
oh
Mm.
my gosh. So then what was your what was your dissertation about?
So my dissertation is actually on sarcoidosis. Sarcoidosis is a disease. It's very similar. It's not cancer, but it is characterized by lesions all over your body.
Oh,
Mhm.
Non,
sarcoidosis? Uh-huh.
yeah, it's a
It's
non.
my first time to hear that word.
Yeah, it is. It is. It's not well known, but it's actually a lot of African Americans have that condition. Also, a lot of Scandinavians have that condition, but it affects mostly the lungs. A
Uh-huh.
lot of these lesions reside in the lungs that affects of course, the breathing. And then
Right.
30% affects it lodges in their eye, it grows in their eye, affects their vision, and some even in the brain that affects,
Mhm.
balance and cognition. So there are,
Mhm.
it is chronic, mortality is very low, but you live with it for
Uh-huh. Right.
Mhm.
time. So I was trying to understand, the quality of life of these individuals, particularly in specific areas of the body system that's
Mm-hmm.
involved, and how they cope with it. So
Yeah.
Right.
I was very sure, of course, when you're young, you're very sure that
Mm-hmm.
when your lung is involved, of course, your quality of life goes down because you can't breathe. Or if
Mhm.
you're losing your vision, of course, you are
Right.
your quality of life because of that vision. But I was totally wrong. The
Oh,
findings were totally wrong. And that's what excites me in science,
Mm.
yeah.
because you have your own biases, you have your own ideas, but the data tells you different. And then
Yeah.
you have to frame another question.
Mhm.
So
Mm-hmm. Mm-hmm.
So
I
Leo,
was
what inspired you to be, to become a
Yeah,
scientist? Because
yeah,
cancer is like, ay, nako, alam mo naman, Ate Zen, di ba?
Yeah.
yeah. So, unfortunately, when I was starting my career at NIH, both my parents had cancer,
Hmm.
and unfortunately, both of
Oh,
them passed away. And as a clinician, as a nurse practitioner, and as a scientist, I'm very frustrated that I can't help them with their especially with their symptoms. So
right.
that's what I want to
So,
focus
so
on.
both your parents have cancer, or just
Yes,
both
yes,
of them? That is so unusual.
Mhm. What
yeah,
type of
What
cancer?
what
yeah.
kind of cancer?
My mom had breast cancer, and
Mm.
Right.
my dad had prostate cancer.
Oh,
Mhm.
Yeah.
those are like the most common cancers. You
Yes,
know,
most
breast
common.
cancer for women and the prostate cancer for men. And
Mhm.
they were in the Philippines, right?
No, they were here. They were living with me, so
Oh, they
I
were
was
here
taking
already. Okay. All
I was
right.
taking care of them. I brought them over.
Mhm. So what
Oh,
is the impact of cancer in your career, in your life, because you saw it.
Yes,
Your
exactly.
parents, you witness everything, their
Yeah,
journey
and
and diagnosis.
yes, and so from that personal experience, I wanted to learn more and really understand the experiences of cancer patients and cancer survivors across, across the cancer spectrum, at the
right.
diagnosis, or if they're receiving treatment, types of treatment, and type of stages. And so I wanted to understand their stories. That's basically because as nurses, that's the key, is really listening. We are at the forefront of every healthcare setting.
Mm-hmm.
So um, that's the responsibility that we have as nurses, is really to listen to these experiences, and that's what I wanted to really capture. What are these experiences? What are the symptoms that my patients are telling me? And then,
Mm-hmm.
as a scientist at NIH, I have a lab, so I also collected, their blood, in order to understand what are the markers of these experiences, what are the markers of the symptoms, that I
Right.
can understand if there are any biological basis of these experiences,
Right. Right.
Mhm.
then
Mm-hmm.
identify those markers that I can use and turn it around and find a treatment for these negative experiences that they have. For example, I was very focused on fatigue because that is the most frustrating um, experience of a lot of cancer. It's a global experience for
That's
cancer
right.
patients,
Mm-hmm.
and no treatment, no FDA approved treatment at all.
For
Right.
fatigue.
Yes.
Mhm.
So this is one of the. It's a genetic marker that you discovered. That's it's cancer related fatigue. So
Correct.
it's so you studied people who had fatigue,
Mm-hmm.
and then you took blood to see if they had these certain markers.
Yes.
So you actually found that they were mostly, that these markers were present in their
Yes.
blood.
Mm-hmm.
Wow.
So I had patients who were receiving radiation and chemo,
Right.
and then I grouped them. Those patients that after they completed treatment, I followed them up 6 months to 1 year. And
Right.
then I've noticed that about 37% of cancer patients who completed treatment
Mhm.
Uh-huh.
continue to have this lingering fatigue.
Fatigue.
Yeah, even 1 to 2 years after they've completed the radiation.
Regardless of the stages
Yes.
of the cancer
Uh-huh.
stages.
Yeah. So I was
Oh.
very interested in comparing.
I'm sure I have that.
Yeah.
Oh.
I was.
Are you always fatigued, Josie?
Yeah.
Well, the problem with me, I'm always stimulated. I have that
Yes.
alertness.
Yeah.
I don't know. Maybe when my when I'm done with my treatment, I'm gonna be like that, right?
Yeah. So, and the thing with the concept of fatigue is really different from being
It's not
tired.
being tired.
Yeah, because being tired, you can recover with a nap, with good food. But in fatigue, it's chronic. It's not relieved by just taking a nap or a good rest. It's just constantly there, and that's debilitating. And a lot of these patients, really affects their work, affects, of course, their social life, and the way they
Right.
And the
perform their
relationship.
roles,
Yeah.
the relationships. Yes. So
Mhm.
I was able to um, group and categorize people who have this persistent fatigue and those without, or for whose fatigue or have recovered, or are have gone back to their baseline, and looked at their blood, looked at the genes first, and then
Mhm.
I've noticed that this specific gene was really coming up all the time. I validated
Right.
with several other patients with other groups, and it's still coming up. And so I tried targeting it,
Mhm.
and so right now I'm doing a clinical trial using low dose ketamine. And
What is
What was
that?
it?
it's a low dose ketamine. It's a special
Oh,
K. It's
ketamine.
not,
Okay.
it is um, it has been shown that when we gave it to patients who are depressed, that when we gave that low dose ketamine, that their depression just goes away after 40 minutes.
Oh.
Hmm.
Usually. So
Even if you don't have cancer and you give it to somebody.
yes, yes,
Wow.
and we're even testing that now with patients who are suicidal, and it
Mm-hmm.
really turned them
Oh,
around.
So Leo, I have a question. So are they using it to treat depression?
Yes,
Because
Mental
people with
illness.
yeah,
depression, can become suicidal.
That's
correct.
So you
right.
know how they have lows and lows. They feel very low. They feel
Yeah,
they have very low self esteem and
yeah,
low self worth.
correct.
Right. So you think ketamine could be
Yeah, it's
like a
actually,
drug that could help them out?
yeah, it's shown that in data after data that it has a rapid antidepressant effect.
Oh, really?
Yes.
Wow,
So
that's interesting.
yeah, it's very interesting, and it's also
Very
has
interesting.
has radicalized psychiatry, actually, because as you
Yeah.
know, with psychiatric conditions,
Right.
depression, anxiety, you take medication, especially orally, and it takes months before it can even take effect. It has to
Yeah.
build. It has to build in the system.
Oh,
Mm-hmm.
okay.
With
Wow.
ketamine, it is rapid. We give an infusion. After 40 minutes, your blueness. You can really see the face. It changes. You
Mm-hmm.
Right.
the depression's
Wow.
gone.
Yeah.
So
Hmm.
I tried it with my cancer patients who had who had fatigue,
Mm-hmm.
Right. Right.
and
And
um,
how was it? How was the
are
effect
still
of that?
we're analyzing
Are you
those. Of
still
course,
they're still under
enrolling.
study?
Yes, I'm still enrolling patients, but promisingly, I had a lot of anecdotal stories that some of my
Right.
patients have received. For example, one patient created this blog because after he had prostate cancer, he's 42-year-old, very
He's
young.
young.
Yeah,
Mhm.
with prostate, but
Mhm.
metastatic.
Actually, I notice, young people with cancer, they're more depressed than the
Yeah,
old
they're more
ones.
fatigued too, the younger.
Yeah.
Oh,
Yes, and at 2 p.m., he is an IT guy. But
Oh,
at
wow.
2 p.m., yeah, he's totally knocked out. He has to sleep because he has no energy left. And that's
right.
often the picture of a lot of cancer patients. At the afternoon, it just wipes them out.
Mhm.
Right.
They can't think clearly. They're just um, tired. And so after we gave the ketamine, he had so much energy that he had to release it. He had to walk up down the stairs
Mhm.
because he had so much energy that to release. And
What
it
are the side effects of this? I'm interested na, ha?
no, of course, because it's a controlled drug, so
Right. Right.
it has to be given.
But
Um,
prescribed by the doctor.
it has to be prescribed, but
Yes.
during of course our administration, you have to be monitored
Mhm.
because it has some psychomimetic effect. It could be some seeing things, hearing things,
Hallucination.
hallucinations. But
Okay.
those are self-limiting. Once the dose is finished, it as far as our experiences, they're all back to themselves. And it's not often all patients experience that. Those are the most common side effects, but the it is short acting. So what we noticed is the effect lasts for probably about 3 to 4 days. All
Uh-huh.
the energy has 3 to 4 days, and that's why our partner group is doing another study where they give several doses of ketamine
Uh-huh.
and see if the effect can be longer. And so we're very interested because not just because it works, but also gives us an opportunity that this could really be a good target, that this could be really a potential area where patients can really be treated for this
Right.
condition that has forever been ignored. And what we've noticed, especially with fatigue, when you talk to fatigue, because there's no effective treatment,
Mhm.
Mhm.
it is frustrating, and providers don't even ask about fatigue. They won't even I mean, because we don't know how to
Yeah.
deal with it, right?
But every time you go to an oncologist, they would ask you, "How's your mood today?" They
Yeah.
Yeah.
always ask me to check this and that.
Yes. Yes.
And you
Wow.
have to rate it 1 to 5.
Mhm.
Ah. Okay.
Yes.
Mhm.
So
All right.
yeah, those are the advocacy that we're really trying to push for every provider there, that we need to ask these questions, especially for our cancer patients and cancer
Right.
survivors, how they feel in terms of their mood, their fatigue, their pain, but more importantly, their quality of life, because that's a big
Right.
that's really a good predictor of how their cancer per se is going, how
Mhm.
they're surviving their cancer as
Mhm.
so
Wow.
um, we're getting what is missing, that's why when I reached out to Josie, is we don't have yet, in at least in the literature, we don't
Right.
have stories of Filipinos and Filipino Americans who lived through cancer, and we need
Mhm.
to tell that story.
And that's the problem because Filipinos are very reserved, and they even have this stigma. You know what? Ngayon, we're looking for participants para sa aming free cancer screening. And I
Right.
approach Filipinos, because we're giving this for anybody who doesn't have insurance. Can you believe? They told me, I want to go shopping. Then, getting a test. But I noticed the Hispanic. Oh my gosh. When you tell them about cancer screening,
Yeah.
as soon as possible, they will sign up.
they're more receptive than Filipinos. I think it could be also because of our culture. There's also a culture of like like I don't want people to know, that either I don't have insurance or that, I don't want to be labeled. It's also a cultural thing for Filipinos, don't you think?
I think, yeah, I know that there are a lot of, like, for example, in New Jersey, you have the healthy heart initiative there with the Filipino Americans, and I'm sure we can learn from those experiences and how to approach. And because I believe it's more on relationship building. Once they get comfortable, especially around food, I think we get to
Yeah.
warm up, and I think we should use that strategy, and we should use that approach to start building relationships so we can hear the stories and we can accumulate those stories and tell it to a wider audience in a platform like a paper, a manuscript that
Yeah.
so people can
We
know.
have to motivate them to participate.
Right.
Alam mo, Ate Zen, ngayon habang kausap ka namin,
Yeah.
Leo, may mga naiisip na akong idea how to motivate.
Right.
But, it's just like a trial and error. Okay, try natin to. Okay,
Yeah.
gather
Right.
natin yung Filipino, let's talk about this. Yung parang, lang na conversation. Kasi sometimes, some of them, they don't wanna go to this, ano na naman, tatanungin mo kami ng ganito, ganyan, That's
Right.
very
But you know what?
intrusive para sa
You what?
kanila.
Right. But you know what, Jose? I think Leo said something about, I think it's really important what he said about how Filipinos like to gather around food.
Yes.
Food is like the attraction. So I think if we have if we offer there's snacks that we can offer
Mhm.
them,
I think what
and
I can do, I will offer them the crab boodle fight in my house or any other places. So, ayan.
Yeah.
I'm going to do that for you guys. Let's talk
Yeah.
about cancer fatigue.
Yeah, but if you just offer maybe empanada and lumpia and some soft drinks, I think they will come and say, it's free. We can get
Mhm.
our,
Yeah.
breast screening done. There's
Yeah.
food here. You can make
Yeah.
friends. You can make
Mhm.
friends, when you come to
Yeah.
places like this.
And you know
So-
what? I'm thinking because we are going to have, as after the free cancer screening, we're going to have the Zumba and the bingo and the
Oh.
Pinay Kitchen in Woodbridge. So Leo, I'm going to invite you. We're going to give these flyers na binigay mo sa amin,
Yes.
and I will give you the opportunity to speak during the program.
Oh, that
Yes.
would be great.
That would be
Yes.
fantastic. Yeah. I
Yes.
volunteer
Yeah,
to
that
bring
would be really
something.
great.
Kahit mga 5 minutes lang, alam mo naman minsan ang Filipino, ayaw nila yung,
Absolutely.
ano ba to? Akala ko ba sasayaw tayo
Yeah.
at maglalaro, di ba? So, Ate
Yeah,
Zen,
that's right.
nandito actually, I'm holding this flyer, na binigay. Can you, ni Leo, and he
Yeah.
the NIH is asking the help of the Filipino American Cancer Care to advertise, lagay natin sa website, sa ating Facebook page, and to reach out to Filipino American communities in the United States. And United States, help the NIH understand cancer-related fatigue. So,
Okay.
again, what is involved and who is eligible to get this, diba?
Yeah, so that's my original study that I was telling you on that I was able to categorize patients who have this really debilitating problem, fatigue, and those that I was able to identify the markers. What was lacking, of course, is the diversity, especially the Asian population, Filipino Americans. We don't have that in our studies. We don't have the stories of Filipino. That's why we're expanding it and making it actually virtual, and so it will be convenient at least, and but also allows the opportunity that we can see you or participate through different platforms. It can be virtually, it can through a phone call, or through mail. So we
Mhm.
can really we sort of provide this opportunity so we can really hear voices from different groups, and especially minority communities that are hard to reach, especially through research, because we need
Right.
voices across our country to really have representation, especially in research, because it affects our clinical the way we are our clinical guidelines. Our clinical guidelines need to hear these voices, and so we'll be able to not be boxed in with
Mm-hmm.
what the
Right.
general population, because all these clinical guidelines are based on research, of course, right? But if we don't have the voice, then there's something that, you know, um, we call it precision medicine, that we're treated individually and optimally
Mm-hmm.
because
Mhm.
of our own experiences or our own unique experiences. So as a community, we really need that voice.
Mm-hmm. And
Right.
Filipinos should understand that among the Asians, Filipinos have the highest number of cases ng breast cancer and colon cancer. It's also because of our lifestyle, of our food, and may mga iba pang factors, di ba? Unknown reasons kung bakit nagkakaroon ng
Yeah.
cancer ang mga Filipino.
Yeah.
Mhm.
And that's part of this study. This study is so comprehensive because it's not just understanding fatigue, but all the other symptoms, as well as, we have your type of activity. We put on Fitbit, sort of your actigraphy activity
Mhm.
watch that we send to you, and we
Oh.
try to understand how you sleep, how your day-to-day activities are, and so we can tell you that, this is the pattern, this is your physical activity and rest pattern.
Mm-hmm.
um,
Mhm.
yeah, so,
Right.
and also, how cancer and cancer treatment affect you financially. That's also another factor. Social factors are huge in these experiences of fatigue, of pain, of symptoms, right, related to cancer. um, this social and economic burden caused by cancer can affect those symptoms. Um,
Right.
yeah, and even spirituality. We have questionnaires about spirituality. Those are we're trying to understand really the whole person on how it affects you, how it affects your current experiences.
Mhm. Right. So there you don't have enough cases. I mean, Filipinos um, as part of your study, and
No,
you're looking for more.
yes,
So
yes.
so I know Josie has, all of these connections, and all of these people that she knows. She wrote that book.
Yes.
Josie, maybe you can tell Leo about the book that you had, like the cancer journey. It's a story of all of these individuals, Filipinos who have cancer, and how they actually um, how they survived through this, through this disease.
Mm-hmm.
And so Josie, maybe those people, you can contact them, or there's other
Yeah.
people that you have an extensive uh, connection with Filipinos here in the US that have
Mm-hmm.
cancer.
So my next question, follow-up question with regards to this, like for example, I'm a cancer patient right now.
You're a cancer
Now
survivor, yeah?
I'm a cancer survivor and under treatment. Do I need to ask the permission of my oncologist if I'm going to participate in this clinical study?
Yeah, that's a very good question. I would recommend to talk to your provider. and mentioned that this is a study that doesn't give intervention or
All right.
being treated. You're just being asked with different questionnaires, and yeah, and get their thoughts on what they think, and I'm pretty sure that they'll be supportive of it because
Mhm.
you're telling your own
Right.
story. But it is great to talk, always have that relationship with your provider.
Yeah, because sometimes Filipinos would think like, oh my gosh, clinical study, they're going to make me a guinea pig,
Yes.
like this and like that. And it's always the fear, di ba? Yung takot. Kaya naman,
Mhm.
you know how it is, Filipinos. They would, sometimes, some of them, mas naniniwala pa sila sa mga albularyo. At saka
Mhm.
yung mga alternative medicine na kung ano-anong mga
Right.
ano yan, supplement doon sa Pilipinas, di ba? But here in America, we have to really, I think we have to think about we're in America. We have the best technology. We have the best doctors. And think about it. We have the only scientists
Well,
sa
actually, it's
NIH.
right. It's really more like, believe in the science, not not in the herbolario,
That's right.
So
But
Mhm.
it's also good to think that if you participate, you are basically helping science. You're helping
mhm. Right.
the next person,
Mhm.
knock on wood, who will have cancer.
And you're saving a life.
You're saving a life. You're making the life of that person better.
Mhm.
Mhm.
Right. And
That's why I would like you to come and attend our fashion show event on October 28th. You know why? Ate Zen, last year, or this is our third year, and
Right.
mayroon tayong special participation. We have now the numbers of the cancer survivors and warriors. Sila yung highlight ng fashion show. They will be walking on the runway. Ito lang yung
Oh, that's-
makikita mo.
that's
Aside from
wonderful.
our mga models na iba. This is the highlight of the program, the survivors walk and the warriors walk.
Wow.
And we
Mhm.
can ask them, 'di ba? We can do it.
Right.
You should bring that flyers. We will give it to them. And
That's
September
powerful.
10, yeah.
Right. That's a way. Yeah. That's a way also of getting participants, to for the study, Leo.
Yeah.
So that would be great. I mean, if we could do this partnership, to help you, to help NIH with its study,
Yeah.
then we can certainly promote that in the at the fashion show.
That's
So
perfect. Yeah, I will be there. Thank you so much.
Mhm. For example, Leo, someone is, like, meron na siyang terminal cancer. And the doctor would say like, you only have like 3 to 6 months to live. Are they qualified to be
Yeah.
part of this clinical study?
Yeah, so that's what this
Mhm.
study is. We're trying to get the picture of all cancer patients across the spectrum, early,
all right,
you know,
late stage, or
because I really wanted to get those stories.
and
What?
it's any type of cancer, right?
Yes, because
So
the more
okay,
we get that, the more we can drill down
right,
on the stories, and depending on their age, the type of cancer, the career trajectory, what cancer treatment they receive or receiving.
uh-huh,
So the more people we can enroll, the more we can really categorize and
right.
reveal their experiences.
Mhm. Are
We
kids eligible?
Hmm.
are
Are
what?
kids with cancer, are they eligible for this study?
For this study, we are enrolling 18 and above for now, and then
Okay.
Okay, 18 and
kids,
above.
yeah, kids have really unique experiences as well. But for this study, it's for adult 18 and above.
Mm-hmm. Okay. So we could even disseminate this information sa mga networks natin. If we have like networks or groups, organizations that we're members of, is that we can also disseminate this to those organizations where we have a lot of
Mhm.
Filipino membership.
Yeah. And we will encourage also our cancer patient beneficiaries, like for example dito sa United States, sa area natin, Ate Zen, di ba?
Right,
And we'll explain it to them. And I'm going to ask my oncologist. I think I'm interested kasi nga, as I said, I have minsan I want to I do a lot of things. I'm multitasking, but I'm sure you are right that mayroon akong fatigue. Hindi ko lang na-acknowledge,
Yeah.
'di ba?
I know. I
Mhm.
know. And it's not just chronic fatigue syndrome, right?
Mhm.
So it's not that you're studying only patients with chronic fatigue
Mhm.
syndrome,
Yes.
because that's very different from, people who have cancer and are
Yes.
fatigued,
Yes. That's
right?
totally different. Yes, for this particular study, we're really looking at fatigue that is related or
Okay.
caused by cancer itself or its
Cancer.
treatment.
Mhm.
Okay.
We
Right.
have 5 minutes on
Mhm.
our radio show. Now, my question is this, we keep on talking about cancer, 'di ba, Ate Zen? And we
Yes,
have that
always.
runway for a cure. As a scientist, this is I just wanted to get your personal opinion. As a scientist, do you think we are closer to getting a cure for cancer?
You know, science is really evolving and it's very fast, and that's the amazing thing about especially in the field of oncology and cancer, that um, different types of cancer have also have different level of engagement and investment
Mm-hmm.
to be involved. For example, in breast cancer, there's really a lot of research and advances in
Mm-hmm.
treatment that has been done. The era of, for example, immunotherapy, the role of the immune system and targeting the immune system has revealed some great um, great potential and promise for
Mm-hmm.
treatment,
Mhm.
and and that also has created and developed even new vaccines to
Right.
prevent cancer, and you've seen that with ovarian, with HPV related cancer.
HPV. Right.
Yeah.
Mm-hmm.
So those are, I think, are the promise that science has brought in
Mm-hmm.
not only the treating cancer but also preventing the
Mm-hmm.
occurrence of cancer. And I think that's very inspiring. And these
Mhm.
are really amazing work of some brilliant scientists in the cancer world. So we are, based on your questions, yes, we have gone to a point where we have been successful in preventing cancer, but also on some particular types of cancer, we've also have provided especially new areas of treatment for types of cancer.
Mm-hmm. Right.
Okay.
Right.
All right. Thank you so
Yeah.
much, Leo, for sharing your time and of course your knowledge to us. And we are very proud of you. Hindi pa to nagtatapos ang ating interview because I'm going to send you a message. And we would like to invite you to our upcoming events because we would like you to be there para ma-encourage din yung mga ibang cancer patients to
Yeah.
be a part of this clinical study. Lastly,
Mm-hmm.
your message to everyone before we close our radio show.
Yeah, so thank you so much, Josie and tonight, Zen, for inviting me to today's radio show, and to the Filipino American Cancer Care for this exciting partnership, especially to advance and to promote our stories
Mm-hmm.
of experiences related to cancer survivorship, living through cancer, and I want to have that platform. I want to have that advocacy to really tell our stories and share it in the scientific community on how Filipinos, how Filipino Americans experiences are related while living with cancer. So I'm looking forward to more engagements,
Right.
and answering more questions, especially busting myths and providing some providing some information on how we can advance and how we can tell our story, unique stories that as a community. So
Mhm.
salamat.
You know what?
Thank
We
you.
have 1 minute on our radio show. Now what I'm thinking, Ate Zeno, as
Yes,
he talks,
I know.
I think what we're gonna do, we're going to gather some cancer survivors, warriors in a open forum.
Oh, perfect. That'd be
Okay.
great.
Yes.
Yeah, that would
And
be
we can
great.
do that here. We can do that here on PHLV Radio. I'm sure okay lang yan kay Johan. Isn't it, Johan? Okay lang ba? Magkaroon kami ng symposium dito.
Yeah, that would be great.
Mhm. Yeah. Okay, so it's 10 o'clock. Approved daw. Oh, ayan ha, mabait yan
Approved.
si Johan. Padalhan ko lang si Johan ng t-shirt.
Yes, thank you,
I think
Johan.
that's what, that's a good idea. You know what I'm saying? Because
Right.
in our area, we identify who are these warrior survivors, and they're gonna be walking on the runway. Now,
Right.
again, on behalf of the Filipino American Cancer Care, thank you so much. Ate Zen, lastly yung message mo sa lahat.
Thank you, everyone, for listening to us and for learning more about what's happening with the studies in the regarding cancer with our very distinguished guest, si Dr. Leo Reyes Saligan at the NIH, the National Institute of Health. So we have a friend there now. So we also need to promote and to support his studies in cancer. So we would appreciate if people who are here in America can be part of this study. Good night to all.
Yes, good night, everyone, and thank you
Good
so
night, everyone.
much. Again, this is Josie Moralidad Zaiman. See you again on PHLV Radio, on the air with FACC.
Thank you.
Bye.
Bye. Good night, everyone. Bye.